Our poster is titled Cardiac PET MRI Unleashing an Emerging Imaging Technique. Cardiac PET MRI as an imaging technique is highly specialized and technically complex, with only a handful of centers performing these scans worldwide. When we first established our cardiac PET MRI service at the PA Hospital in December 2015, there was very limited literature available outlining imaging protocol parameters. This poster explores how we established our cardiac PET MRI imaging service, the imaging protocols we have developed, and how it is utilized clinically to have optimal benefits for patients and treating clinicians. The Princess Alexandra Hospital is leading the way with respect to the development and implementation of cardiac PET MRI here in Australia. The service is supported by a dual-trained cardiac MRI radiologist, nuclear medicine consultant, and a highly trained group of nuclear medicine technologists and MRI radiographers. Standalone cardiac MRI is widely accepted as the gold standard imaging modality for cardiac infiltration. However, combining both MRI and PET offers many additional advantages. We want to demonstrate how cardiac PET MRI is being used clinically here in Australia, including the modality's advantages, as well as outline specific imaging protocols that other centres could model off. Since the inception of our cardiac PET MRI service in December 2015, we have scanned a total of 62 patients. The most common indications for performing these studies were suspected sarcoidosis in 44 out of 62 cases. Other indications we've encountered include non-specific infiltration, suspected amyloidosis, infection, and malignancy. Over time, we've established a comprehensive referral base with clinicians beginning to understand the benefits of the clinical results available. Our imaging protocol has been modelled around the SCMR guidelines and our standalone cardiac MRI imaging protocols. Currently, we have two distinct imaging protocols that we utilise: the full or comprehensive protocol, which allows for functional and viability assessment of the heart, and the limited protocol, which focuses on viability assessment. Patients who have had a standalone cardiac MRI in the 4 to 6 weeks prior to the cardiac PET MR generally have the limited protocol performed. The specific sequences performed for each protocol are outlined in the table on this slide. The clinical use of cardiac PET MRI continues to grow at the PA. Based on our experiences, it should be used in cases with suspected cardiac infiltrative diseases such as sarcoid to assist in differential diagnosis and defining treatment pathways. Some key advantages of cardiac PET MRI include improved reporter confidence when dealing with non-specific scars and infiltration, identifying differential pathology attributing to clinical symptoms, and greater accuracy determining appropriate treatment pathways. Cardiac PET MRI offers images that cannot be rivaled by standalone cardiac MRI or PET-CT alone, and is playing a positive role in the management of patients with a wide range of clinical pathologies which we continue to explore.